Plastic surgery is transformation. Once the last resort to combat aging and deformity, today it is the cutting edge. From life-threatening traumas to the endless search for beauty, plastic surgeons are shaping and sculpting humans into a perfection of form and fancy. Welcome to the world of plastic surgery, before and after. The head. It's the epicenter of our emotional and intellectual lives. When damaged, plastic surgeons must navigate a complicated tangle of medical and emotional realms, where matters of the heart and the scalpel meet.
Plastic surgery is about solving problems. A lot of our understanding of the anatomy of the head and neck comes from reconstructive surgery due to accidents. In fact, that's how much of cosmetic surgery of the head and face came about. Hi, I'm Dr. Jan Adams, a plastic surgeon in Beverly Hills, California. Where craniofacial surgery is called for, it's not just a question of putting the pieces back together, but it's also about preserving our sense of self and our very identity. And that's what you're about to see. From a victim of domestic violence who regains the symmetry of her face, to a doctor who pieces together the shattered skull of a woman trampled by a stallion. Whether it's for cosmetic purposes or reconstructive necessities, the art of plastic surgery is rapidly expanding, and the results can be quite amazing.
Next on Before and After.
In one swoop, ripped off my ear.
A missing ear after a terrifying run-in with a pit bull. December 1993. Louise Egan was spending her first Christmas alone. Just out of a bitter divorce, she was fragile and at a low point in her life. She thought things couldn't get any worse, but little did she know they were about to take a terrible turn. She was at home alone when her cousin Susan came over with her pet cats. One of them disappeared. Hearing barking dogs, Louise went to check if the cat had slipped into her neighbor's yard.
I needed to look over the fence just to prove that the cat wasn't there, because I knew it wouldn't be in there. I found that I couldn't see over it, so I was just looking to the side for something to stand on to get taller to see over the 6-foot fence.
Then she felt a violent, forceful crash to the side of her head, and suddenly everything became a blur.
The pit bull came at me from this side over the fence, put its front claws in, and just in one swoop ripped off my ear and pulled out a whole bunch of hair and fell backwards.
Blood poured from her head, and she was rushed to the emergency room. But since it was Christmas Day, doctors were scarce. Lucky for her, plastic surgeon Dr. Donald Altman was on duty, helping out colleagues who were home for the holidays.
I recall there was some politics of how to get the ear from the dog and which dog that might have been, but when I finally got to the hospital, the ear really was no more than a little digested piece of fat.
All he could do was sew the ear hole shut to prevent blood loss and infection. But 6 months later, with the wound healed, Louise and Dr. Altman could start the next stage, rebuilding the ear itself. She was impressed with Dr. Altman's track record and reputation, and Louise decided to continue being under his care. The outer ear is a complex organ and is difficult to rebuild with the tissue from other parts of the body. So Dr. Altman decided to try a curved plastic prosthetic to replace it. The surgery to implant the plastic ear was successful, and healing seemed to move along well. But then something unusual started to happen to Louise. Dr. Altman had used skin from her abdomen to cover the plastic ear.
It was disconcerting to find that the abdominal skin, after that much time, had taken root very well, but began to grow pubic hair right around the edge of my ear. I had kind of a fuzzy little ear, and it was quite a surprise.
So it was back to the operating room for surgery number 3, this time to graft skin from behind her neck to replace the hair-covered prosthetic. But a small cleft remains between the earlobe and the rest of her ear, so Dr. Altman wants to take the last steps to perfect her restored ear.
The little cleft that's still in my ear isn't bothering me as much as it's bothering Dr. Altman. He sees that he always wants to just fix that up. It could be just that little bit better. And the way I wear my hair, it wasn't a strong concern.
Hi, Louise.
Good morning.
Nice to see you.
Yep, good to be back.
Louise decides to go in for the final touch-up to make her reconstruction complete. For Dr. Altman, it's one last inspection before he starts.
Let me just take a little look here, make sure it's still where we were.
When people lose a limb or part of their body, they sometimes continue to feel it long after it's gone, a phenomenon called phantom limb. Louise Egan had this kind of experience with her missing ear.
Whenever I'm talking about my ear, it starts to throb. I feel it. I call it she's throbbing. I feel it. It's there's something going on there.
This is going to be fun.
Okay.
What the plan for today is just to pull that little earlobe like I showed you in the picture, just to pull that up a little bit so that this flows a little better. There's an unnatural break where I connect it to the earlobe, and I'm hoping to make that just a little better.
He administers a local anesthetic and begins to make the cut right over his marked lines.
Doing okay?
To make sure Louise is calm, he casually chats with her throughout the surgery.
Earrings sometimes, they get pulled through and people have little clefts in their earlobes. We probably repair 1 or 2 earlobes a month over the last 10, 15 years. We were going to call that part of our practice Jiffy Lobe.
After cutting, Dr. Altman sews up the area.
We're using a suture called Prolene, probably the most common suture used in plastic surgery, and it has to be removed. Stitches that have to be removed cause less inflammation than sutures that are dissolving.
He hopes the procedure will make Louise's ear as close to its original shape as possible.
So what we're really trying to do is fool the mind's eye to believe that this thing was intact all along.
Dr. Altman and Louise are pleased so far, but they both understand it will still be weeks or even months before they know how the new attachment holds. 4 months after her last surgery, Louise is happy with her new ear and is enjoying both the physical and mental changes that came with it.
It's now more of an ear shape so that it doesn't pull your eye away and look like, oh, there's a little notch in her ear. So I'm more confident, I feel more comfortable with it, and I'm very surprised because it was such a tiny surgery and it made a great big difference in my confidence.
Best of all, the recovery was much easier than she expected.
In less than a week, I didn't feel anything. It didn't hurt. The second night I was sleeping on the ear again. The stitches came out in a week.
Next comes one of the hardest parts of recovery, getting comfortable again with animals, specifically dogs.
There's still a nervous reaction to dogs, but it's just the way they come at me. And if I'm ready for them, and I'm more sensitive to it, but not afraid.